global health policy expert Mario Ottiglio, who's in Geneva. Good to have you with us. A lot of excitement over the news from Pfizer yesterday about this, the possible vaccine. However, one of the issues with it seems to be that it has to be stored at -70 Celsius. How difficult is that going to make it to transport it and store it?
Good evening, and thank you for having me. Yes, this is definitely an important issue to take into account. As you said, we really need, it seems, a super cold temperature, -70 and below, which is going to make quite difficult to deliver this to many places. So from what we know at the moment, of course, we don't have a lot of information, but this vaccine seems to be able to be in ultra low temperature for up to 6 months or 5 days at, let's say, normal temperature around 8 degrees, which is quite commonly available in hospitals. It seems also that the companies have designed some sort of suitcase-sized containers that may keep the doses at quite cold temperature for up to 10 days. And each of these containers may hold between 1,000 and 5,000 doses, and may also be refilled with some ice. But of course, the point is the shots will spoil in around 5 days and normal refrigeration temperature, making, let's say, inoculation quite difficult. It's a new technology as well, and therefore we need also a new delivery system. And that, I think, it's part of the challenge that Pfizer BioNTech have right now.
Right, and this vaccine, as I understand it, isn't part of the COVAX program either. So, in broader terms, how difficult is it going to be to distribute this vaccine? I know it's not the only one, but if it's the first one, how difficult is it going to be to distribute it, particularly to lower income countries in poorer areas?
Yeah, thank you for making that point. This would be a challenge in low and middle income countries. I would say it's a challenge in all settings, because hospitals, even in big cities, let's say in the Western world, do not have storage facilities for a vaccine at that ultra low temperature. So it's going to be challenging, in particular, when it comes to the last mile. This actually adds up to a series of other challenges in vaccine distribution, looking at production of other materials, legal agreements, and all the things that you need for fully country readiness, communication, training, data collection, general guidance. One important point here, for this reason, I think one needs to continue supporting research efforts in order to achieve a sort of a basket, a portfolio of options that can be adapted to local constraints. We know that there are COVAX and a few other agencies are working as well to resolve that very point of lower and middle income countries, because clearly, as you had before with Dr. Tedros, we will fail if we will not achieve equitable distribution when the first one is ready.
Okay, so let's imagine a perfect world where there are billions of doses of vaccine going to every country. One of the other issues is that there is a sizable percentage of every population that don't want to be vaccinated. They don't trust vaccines, they don't want vaccines. Do you think this vaccination should become mandatory, or how do you persuade people that for the good of the world, they really should get this vaccine if it's proved to be safe?
This is a great question. Let's say we learned this great news about the Pfizer vaccine, but we also learned that we have some homework to do, because, as you say, vaccine hesitancy is going to be an issue in many places in the world. And this can only be overcome with reliable data, with ultra transparency, if that's an expression, and also adequate communication. For instance, I'm just thinking about the side effects, right, or the possible side effect. For instance, if we have ultra transparency on that, in communicating about the impact of that vaccine, that would be great, because even if there are no serious long-term complication, people feeling sick for a day or two could lead to some to be hesitant to take a vaccine. I think, and I made this point earlier, we need a sort of a all-of-a-community approach when it comes to adequate communications as well. We have seen often authorities not speaking with one voice, where you had the scientists saying something and the politicians say something else. We need to make sure that we ensure a stream that is coherent when it comes to communication and talking to the people, to have them empowered with the right information. And you know, like, as you say, really like act everybody towards the direction that we want to go, which is getting rid of this and, you know, restart our life as it was before.
Well, let's hope. Mario, thank you very much indeed for that. Mario Ottiglio there.